Good morning, Professor Kelly and my dear friends, and I thank you all to giving me this opportunity to present myself in front of you. My name is Sonali, and my capstone topic is mental health of nurses. So here I took one study conducted by Canadian Federation of Nurses Union. So they collected data from 7,358 regulated nurses from RNs, LPNs, RPNs, and NPNs. In this finding, they have some shocking results. In this finding, 36.4% of people had a major depressive disorders and clinical burnouts, and 29.3% are suffering from generalized anxiety disorders. Each affected more than 1 in 4 people. The prevalence of post-traumatic stress disorder is 23%, and panic disorder 20%. 1 in 3 nurses reported planning suicide, and 8% of nurses reported trying to committing suicide. So these are the shocking results according to this study. So I have some implementation plan. So to reduce the clinical burnout, so these are as encourages teamwork. So if leader encourages teamwork, then it will automatically decrease the stress on one nurse. It will divide the work among all. So so the pressure and burden on one nurse will decrease. Second is encourages break. If leaders encourages break, because the due to hectic schedule, the nurses are suffering both mentally and physically. So to reduce these burden, leaders can encourages break. And the third one is decrease nurse patient ratio. So leaders can decrease nurse patient ratio so that nurse can focus on few patients in better way to promote the quality of care. So here I would like to give you one example. So according to this studies conducted according to these studies conducted by American Medical Association, nurses in hospital with patient to nurse ratio 8 is to 1 are twice as likely to exhibit severe emotional tiredness as those in the facility with the 4 to 1 nurse patient ratio. So leader must also involve them while making the schedule so that they can give their preferences and discuss the things which cause any problem, so they can involve them in the schedule. So here the one theory is applicable is the Newman system and model. Betty Newman's created a nursing theory that is based on person's relationship to progressive stress response and reconstitution factor. So this theory is applicable on nurses' mental health as they deal with stress, and it leads to good relationship. So leadership can adopt democratic style of leadership because this style of leadership promotes team communication and input when making decisions. This kind of leaders place a strong importance on relationship and ensures that their team members are free to express their worries and thought and ideas. So if the leaders involve all of them to in the decision making process, so they can discuss their worries, stress and tension problem which they are facing at their workplace. So this is the best leadership style leaders can adopt to overcome this problem. So the next part is expected outcomes and sustainability plan. So if they follow the points which I mentioned earlier, so it will result in better care. So if the nurse have decreased stress and tension, they can pay full attention to the patient, which leads to good quality of care to the patient. Apart from it, the general well-being of nurse and is improved because they have less worries and tension. They have increased career satisfaction because they love their job, and if they have less stress tensions at work area, it promote good environment, so it will lead to less errors at work. So this is the also good outcomes. For the sustainability plan, leaders should adopt some of the measures which I gonna explain. Like first is should address nurse concern, support nurse welfare, promote breaks, provide flexible hours, streamline nurse workflow, decrease nurse to patient ratio, and collaborate with nurses in order to reduce nurse burnout. Take feedback, made strict guidelines to follow. So, according to me, take feedback is the most crucial point because they already implement the plan. So they have to follow up that how that implementation plan are working. So according to that outcome, they can plan some different ideas to work on it. So this is the all about my capstone plan. So I'm thankful to all of you. Thank you, Professor.